Yes, good afternoon, everyone. I hope I'm audible and clear. Thank you for joining us today for yet another session of the Sphere India Academy. This series on this webinar today, we are going to talk about including snakebite as a disaster in state disaster list. So this is a webinar, the first one actually on a series of 19-month-long collaborative webinar series we have been planning along with our collaborators. And we have designed as a shared learning platform to bring together evidences, field experience, policy perspectives, and practical solutions on complex humanitarian and public health challenges, especially pertaining to climate change. And we are grateful to have you all here join us today. And the topic of today, we are going to talk about snakebite envenomation, and it is both timely and deeply significant because today is actually World Neglected Tropical Diseases Day. And snakebite envenoming is officially recognized by the WHO as a neglected tropical disease, which is disproportionately affecting the poorest, most marginalized, and disaster-prone communities. When you talk about India, India bears one of the most highest burdens of snakebite globally, and states like Assam face compounded risk due to flooding, agrarian livelihood, forest interfaces, and displacement. Snakebite is not just a random event, it is closely linked to seasonality, housing condition, occupation, and disasters, and making it both a public health and disaster risk issue. And recent evidences suggest that including field-based research use snakebite rescue data to understand snake-human conflict. It shows us the encounters are predictable and pattern, and often peaking during monsoon and post-monsoon periods, which we can see that Assam is greatly affected during the flooding times, and it is more at night and within domestic spaces. This reinforces a critical message: snakebite deaths are largely preventable when systems are prepared. In this context, the Honorable Chief Minister of Assam has recognized the achievement of zero snakebite death at the Demo Model Hospital and Community Health Center. It is extremely important to today's context. It demonstrates that with preparedness, trained health system, availability of anti-snake venom, and community awareness, snakebite fatalities can be eliminated even in high-risk settings. This success often offers values lessons for policy, health system, and disaster management framework. And globally speaking about snakebite, the WHO Global Strategy for Prevention and Control of Snakebite and Envenoming of 2019 calls for 50% reduction in snakebite deaths and disabilities by 2030, emphasizing community empowerment, strong health system, access to treatment, and multi-sectoral coordination. Today's discussion also directly contributes to that global goal. We are pleased to conduct this session in collaboration with our knowledge partners, PRISM, with Aniruddha sir guiding us, and knowledge partner and my guide from Universal EHS, Sanjay sir. Sir has joined right now. Let me admit it. And as we begin this webinar, we hope today's conversation will set the tone grounded in evidence, focused on equity, and oriented towards solution as we collectively explore how preventable deaths can be truly preventable. And thank you for joining us. I officially begin the session. Before we go to Vishal sir, Aniruddha sir, would you like to take a couple of minutes to talk to us about the topic? And meanwhile, we can wait for Banu sir to also join. Aniruddha sir, you have been muted. If you could please unmute yourself. We are not able to hear you, sir. Aniruddha sir, we are not able to hear you.
Can you hear me now?
Yes, sir. Loud and clear.
Okay. So, snakebite is a very common thing for people to die. At the same time, WHO has prescribed one thing, that is 50% reduction of snakebite deaths. So we need to, because if we see in India, in the disaster management departments, so there are SDMS, state disaster management authorities, in every state. So except Odisha and UP, other states are yet to come to a conclusion that snakebite can be included in the disaster list. So, if it is in the disaster list, then there will be multiple benefits. I'm not talking about the monetary benefits. I'm talking about the awareness generation. I'm talking about the uh, government's this thing, uh, taking action, and then several other things. So on that issue, it is very recently uh, the CM of Assam, Chief Minister of Assam, Dr. Himanto Biswa Sharma, he has actually wrote a letter to uh, Demo, which is a model hospital, which is situated in Shivsagar district. So Shivsagar is the remotest area in Assam, and I believe that Sanjay Da is here, and I believe that Dr. Surajit Giri, who is the key person of that, he will also be there, joining there soon. And Demo has become a model, this thing, but this is not enough. I have requested Fair India Secretariat. I have requested the chairperson, and chairperson has drafted a letter, and that has been shared with Krupa. So she will share that later on. So now the thing is that the discussion can go on, and main objective should be that all the districts, all the states should consider this snakebite deaths in the snake bites in the disaster list. So for that, whatever we need to do, I mean, there are snakebite hotspots, so we need to identify. We need to do something for advocacy reason, so we have to do that. So from Sphere India, it is our commitment. From Prism, it is our commitment. From Carnegie, it's our commitment. And because from Carnegie, I have seen that Nandini Channel is already there, and maybe the co-chairperson and co-convener, his Professor Sheikh Tawhidul Islam, he couldn't join because he is from Shanghai. He is now based in Shanghai. So now he has gone to Shanghai. He is based in China, in other city, and he couldn't, maybe because of the network issues. So I will also not be able to continue much longer because I am in Mizoram, I am in Aizawl, and I am traveling. So on the roadside in a small dhaba, I have been trying to actually communicate with all participants, and thanks to all the participants and whoever will join. I am saying thanks to them too. So I would request Krupa to just convey this message to them if I cannot continue. Thank you.
Sir Sheikh Tawhidul Islam sir has actually joined, and he has dropped a message also saying he has joined. So welcome to him as well.
Okay, thank you. So now Dr. Vishal Santra can start the session.
Yes. Thank you, sir. Thank you so much. And before Vishal sir begins, I would like to take the honor of introducing sir to the participants.
Yeah.
I would like to take a couple of minutes to briefly introduce and tell you how his journey began. So Vishal sir actually grew up in the northeast of India, where his interest in snake germinated. He traveled to West Bengal for further studies, where those interests took prominent shape. We soon realized that conserving snakes will only be possible if he can prevent snake bites and provide answers for the many questions pertaining to snakebite in India. This led him to forming a registered society that works towards human-snake conflict mitigation, conservation research, and community engagement. Sir has developed important collaborations and associations with some of the leading organizations and institutes working on the snakebite problem, In this capacity, Saran has been leading many snakebite projects in different regions of the country. You briefly talking, he is a herpetologist, educator, administrator, project supervisor, and for people that would like to know his designations, he is a member of the IUCN SSC Viper Specialist Group. He's a reptile consultant. He's secretary and herpetologist in the Society for Nature Conservation Research and Community Engagement. He is also the co-founder and co-director reviewer of the Captive and Field Herpetology Journal, and he also worked as a consultant for Snake Research Institute, Gujarat. Welcome, Vishal sir. You can take it forward, and I will help you with the presentation.
Thank you, Krupa. Because I'm in a limited network area, I'm not switching on the camera so that I can have more bandwidth. I hope that's okay with everyone.
Absolutely, sir. Understand.
Yeah, as Aniruddha sir has set the tone for the meeting today, that every state should include snakebite as one of the listed disasters. I'm not very sure what we mean there, but we can come to that discussion later on. But to my knowledge, I think a lot of the states in the east of India and the north of India, the disaster management department basically provides the ex gratia following a snakebite death. So somehow snakebite is related with many of the states' disaster management department. So when in one of the groups, when we mentioned that disaster snakebite, relating snakebite to disaster, it's going to be tricky because snakebite is considered as an accident. So relating snakebite and disaster might need some discussion and some brainstorming. But anyway, we can come to that later. So why the states need to be really proactive when it comes to snakebite? I just want to draw everyone's attention to this idea that the state needs to be more proactive when it comes to snakebite, with two examples. So I will be sharing a presentation where there are two examples, how we can implement it on a state level. Now, when I say state level, it doesn't necessarily mean that we need everything for the state. What we need to understand is snakebite is a major public health problem. There is no doubt about that. With the recent involvement of Government of India, and I was also a part of their expert committee where we drafted the NAPSI, the National Action Plan for the snakebite envenoming across the country, as a framework for different states to copy, borrow, and then modify according to their state's need. Before even addressing the snakebite situation at a state level, we all need to understand one thing: is India is demographically, culturally very diverse. So we can have a very basic framework nationally, but we need to design and draft either educational approaches or even mitigating medically, or even with the antivenom on a very region specific basis. Because this has been told, I think, and most of you know already, that India is home to almost 400 species of snakes, out of which about 66 are venomous. And out of the 66 venomous snakes, there are about 22 snakes which have been considered medically significant venomous snakes by the Ministry of Health and Family Welfare, Government of India. Now, again, it's very important to understand the term medically significant venomous snake. So when do we call a venomous species medically significant? It is when a species have been documented to be responsible for a bite and a following death. That is when, even if one person dies because of one snake's bite, one species bite, that species will be considered medically significant. Like a lot of pit vipers, let's say Malabar pit viper, may not be considered as a category 1 medically significant venomous snake, because we don't have any documented deaths due to a Malabar pit viper bite. But we will say hump-nosed pit viper is a medically significant snake because we have documented deaths happening because of a hump-nosed pit viper bite in the south and even in Sri Lanka. So let me just start with the presentation so that you get a broader idea why states have a very important role when it comes to addressing this massive problem that we have been suffering from a long time. So what you see here is a map that a lot of you must be aware of. It's a study that was conducted in 2005. It's called the Million Death Study, where the researchers have asked for the deaths and the addresses of the people that have died from the Registrar General of Deaths and Births, Government of India. And they randomly sampled different states, and they went to the deceased house and they conducted verbal autopsy, and they established the cause of death. So from that data and a lot of mathematical models, they have come up with the numbers of deaths that we now quote in a lot of our studies, saying that India is the snakebite capital of the world, where we lose about 58,000 people annually due to snakebite. But interestingly, if you look at the map, the white areas in the north, in the northeast, in the Andamans and Nicobar Islands, and also Kerala and Goa, they could not get data from these states. And if I can add on to this, the north and the northeast are very interesting biogeographic zones of the country, where the so-called big four venomous snakes for which the antivenom is designed may not be present. And now the question is, then if those snakes are not present there, what are the snakes present there that are biting people? Or are there deaths there? Yes, there are deaths there, but there are different kinds of snakes, not necessarily the big four species for which the antivenom is designed. Now let's take an example of the northeast. I'll just take an example where I have worked. I have worked in the states of Mizoram, Manipur, Sikkim, Arunachal Pradesh, and Assam, and Manipur. So out of these states, so let's take Mizoram as an example. Next, please. Next slide, please. Can I change, Krupa? Yeah, thank you. So what comes to our mind when we want to address snakebite are two things. One is a short-term fixes, which we already are doing, and there are long-term fixes, which will be the game changers. So we will be focusing on the short-term fixes that we are already doing, but we have to improve it. So in that short-term fixes, it's basic research, education and awareness, antivenom design and production. These three we are already doing it. We just have to better it. Clinical management may be variable from place to place, from region to region, from hospital to hospital, from individual clinician to an individual clinician. Again, why I'm saying that is because if you pick up any medical course in the country, you will not find a very detailed chapter or a book or a session on snakebite. It's very basic. Whatever the clinicians learn is during their internships or their house staff shifts in different hospitals. Again, based on what hospital they are, they have got their house staff shift or internship. Depends. Like it's a high snakebite handling hospital or it's a very low snakebite handling hospital. And then there are transfers, and there are personal or individual interests in snakebite or in cancer or in HIV. So it's very variable. And again, public health and epidemiology is still an ongoing thing. In the NAPSE draft, we have talked about and discussed about a proper epidemiology. Now, a lot of the states have made it mandatory to report snakebite. Snakebite is still to be a notifiable disease like dengue or like cancer or like HIV or like COVID-19. it's still in the process of being a nationally notifiable disease. Whereas some states have taken the initiative to make it at least at the state level notifiable, which was missing from a lot of the states' action plan. Next, please. Next. Yeah. Coming to the drugs. So we all know that snakebite, if there is an envenomation, we need an antivenom. So two things stand out. One, what species have envenomated? Second, what antivenom are we going to use? Does this antivenom cover the species that has bitten the person? Do we know that this antivenom does not cover the species that has bit the person, but there might be a certain degree of cross neutralization? Do we know how much cross neutralization happens with a certain product? So all these questions need to be answered if we really want to address snakebite in a very holistic or in a very consolidated way over geographies, if not states. Next. Again, I don't have to spend much time on this slide because you all know that these are the big four, so-called big four venomous snakes of India for which the antivenom is designed. Spectacled cobra, common krait, Russell's viper, and saw-scale viper. These are pretty widespread species in across India. But again, if you look at the maps, the north and the northeast do not have it. Again, these maps are not very accurate. There are multiple other species of medical significance that are distributed across this landscape, which we will come to in our example slide. Next. Okay, so Northeast, the challenges that we had initially in the Northeast was there was almost no documentation of reptiles, like at least how many venomous, how many non-venomous, where are they distributed, like does the entire Northeast have the same distribution, same species, or there are overlaps, there are, very significant niche that a certain species inhabits. All of that were lacking. We did not know what are the medically significant venomous snakes in those states. Epidemiological data was almost negligible, zero. Um, Venoms never collected, never characterized. Nobody tested the venoms on the present Indian antivenoms or how that antivenom neutralizes, how much the antivenom cross neutralizes those venoms. And then there was very limited published case studies. Again, Assam, Sibsagar, Demo Rural Hospital, Dr. Giri took up this initiative and he actually pushed it pretty far, pretty good, where he has started producing evidences, which is a very, very important part of our exercise, where we, generate evidence for the policymakers, because the policymakers are not going to make any drastic change or a plan just based on verbal communications or meetings. Next. So let's take Mizoram as a case study. I have worked in the northern districts of Mizoram, Kolasip, Mamit, Aizawl, and Champhai. Next. Next. Yeah. So what we did from 2016 to 2022 was we have systematically surveyed the entire 4 districts. And we collected blood samples and venom samples, and we did venom characterization. We compared the venom with the big 4 venom, then we compared the Indian antivenom and to see how much that antivenom cross neutralizes certain species of snakes. And we also did a lot of training and community awareness. Next. So after the survey, what we got was a bunch of snakes that are medically significant for the state of Mizoram, of which none are the big 4. But in the current NAPSE document, at least 5 of them have been listed as medically significant venomous snakes. So can you see my cursor? My arrow is visible, not visible on the presentation.
It's not visible, so it won't be
Not
visible.
visible. Okay.
Actually.
Anyway, so I will just read out the names.
Mm.
So the mountain pit viper, king cobra, monocle cobra, greater black crate, and the spot-tailed pit viper have been identified as medically significant snakes of Mizoram by the NAPSE, by the National Action Plan. So, and none of these are big four. So technically, the antivenom that India produces right now uh, is not designed to neutralize these snake bites. But do we know how much the present antivenom cross neutralizes the same species? So coming to that, next slide. Sorry, I just missed this part. So we also did a lot of genetic work. So because you must have heard a lot about venom variation within the same species or between species. It's very important to know that the venom variation in a species or between the same species um, is driven molecularly. So every venom molecule is genetically coded. So there is a gene that's responsible to produce that particular toxin. So if there is molecular divergence between populations of the same species over a geography, there will be variation in venom. Not necessarily the diet or the environment or the biogeography. Yes, biogeography, environment, diet did play a role in a very long term to shape the molecular divergence between those two populations. But that's not the driving factor for the venom variation. The venom variation is based a lot on the molecular relationships between populations and snakes. Next. Next. Okay. So this is a very interesting. So why we did molecular work was to understand venom variation and how antivenoms work. What you see here is an SDS page where we have tested three green pit vipers from Mizoram, from the northeast. One is Trimeresurus meadowensis, or the meadow pit viper. One is Trimeresurus popiorum, or the Pope's pit viper. And one is the Trimeresurus erythrurus, or the spot-tailed pit viper. So we tested an Indian antivenom, and we also tested the Thailand-produced green pit viper antivenom on all the snakes venom. So if you look at the columns that says GPV, it is the green pit viper antivenom which has been used. If you look at the PS, it is the premium serums antivenom that we have used. And the SDS page is the protein bars that you get after you run a gel on crude venom. So what we are looking at, which the venoms that are really dangerous to humans, is below 36 kilodalton. All the lower molecular weight toxins are the most dangerous ones. If you look at Trimeresurus meadowensis, the green pit viper antivenom did not identify a single protein band, but the premium serums did identify a couple of bands which are much higher in weight, in molecular weight, which we are not bothered with. If you look at the Trimeresurus popiorum venom, you can see that the green pit viper antivenom has identified one protein band, which might be around 22 kilodalton. And if you come to Trimeresurus erythrurus, you can see that the green pit viper antivenom has identified all the protein bands, of course, at a much higher dose. But why do you think that it has identified all the protein bands? This green pit viper antivenom is designed from a species called Trimeresurus albolabris, the white-lipped pit viper. Why did that antivenom identify all the protein bands in Trimeresurus erythrurus? Because these two species are related very closely genetically. That's why the venom, the toxins are also pretty similar. That's why we can get this amount of identification by another antivenom. This is why molecular study is also very important when we are looking at cross-neutralization studies using different antivenoms to treat different snake bites. Next. Okay, so why venom studies are important? Here you see a reverse phase HPLC performed on three different venoms of two species. The top one is Nyakauthia, or the monocle cobra from Mizoram. The middle one is also another Naya Kauthia from West Bengal. And the bottom one is Naya Naya, or the spectacled cobra from Tamil Nadu. So if you look at the peaks, these peaks are all protein peaks. They're like fingerprints of a human hand. So every venom will have a very unique uh, spike regarding what kind of protein that, or what kind of toxin that venom has. Now, each peak can be a single toxin or multiple toxins. If you look at the Mizoram monocle cobra peaks, it's very different from the West Bengal monocle cobra peak, and vastly different from the Tamil Nadu's spectacled cobra venom peaks. Now, the bottom venom is the venom that is used to produce antivenom. And the antivenom will have immunoglobulins that will recognize the peaks that you see in the bottom profile. Now, it is very unlikely that those immunoglobulins will identify the peaks or the proteins that you see in the middle and the upper graph. That is why we need to understand that there has to be a very rigorous science which should decide on how the venom cocktails need to be designed to produce either a pan-India antivenom or genus-specific antivenom or region-specific antivenom. That is why these studies are very important, and these are very state-oriented. Like, it's difficult, first of all, to get permissions from the Forest Department to conduct such studies because all these snakes are listed as protected species under the Wildlife Protection Act. It's very difficult to approach states through centers because of different political reasons or different other reasons. It's very difficult to conduct a massive, large-scale study across India without states becoming proactive and providing these necessary platforms for researchers like us to study the species and understand the complexities, and then come up with a possible answer on how to go forward with the antivenom design in the country. Next. Here we have tested 4 antivenoms that's produced in India. Again, it's a immunoaffinity chromatography study where we have mixed the venom with the antivenom and then run the different SPLC tests where you can see a lot of non-retained or retained peaks. So you can see there are a lot of retained peaks. So that's the concern. That means the immunoglobulins in the antivenom did not recognize those toxins. And those toxins can be responsible for deaths, even if you have given a lot of antivenom to the person. Next. So it's very important to generate credible scientific evidence for policymakers. If we even if we have to argue with the policymakers or present a case that why this decision needs to be made or why that policy needs to come up, should be based on evidence. So that is why certain researches in venomics and antivenomics, as well as taxonomy and biogeography, are very, very important, which is quite impossible to do without state being cooperative or helpful in providing with the necessary permissions that are needed to conduct these studies. Next. Okay. So this is another example that I wanted to use. So this is a short study we did on evaluating rescues, understanding distribution of snakes in a given area. And again, as we have involved state taking the front seat when it comes to addressing snakebite, this will only happen state specific. It cannot happen nationally because nationally species are different, the distribution of species are different, way of doing things are different, governments are different. So it has to be a state's initiative that needs more as the steering wheel for understanding that these studies or these ways of understanding the conflict and the ecology between humans and snakes in the entire Indian landscape is possible. It has to be a state-based thing. It cannot be, yeah, the national policy can provide you with the framework, but the state has to take it up to design it according to their ease of functioning and ease of executing. So here what we did, can you hear me now? Is it clear?
Yes, sir, we can hear you.
Yes, yes, it is clear. Voice is clear.
Okay, thank you. So here next, what we did was, Kripa, can you do next? So what we aimed was to standardize the rescue methodology so that we don't miss out on data or avoid a lot of errors, and to utilize the rescue data to understand the human-snake interface in an agrarian landscape. So one thing needs to be understood is snakebite happens, most of the snake bites in the Indian landscape happens in the agrarian landscape, where people do agriculture, where people live, where the agricultural lands are edged by forests, villages living near forests. Very, very, very few people get bitten going into the forest. Most of the snake bites happen on an agrarian landscape. So that's why we need to focus on. We cannot say that Western Ghats has so many king cobras, so why are there no bites? People go for safaris, people go for wood collection, people go for honey collection, people go for leaf and fruit collection, but nobody gets bitten by a king cobra in the forest. But people who handle, people who rescue, people who fool around with king cobras do get bitten. So that's how we have to understand snake bite. So that's why we decided that we will understand, we'll aim this in understanding the human snake interface that happens in an agrarian landscape, and also to develop educational matter. Like, for example, uh, none of us, I think, at least for me, yes, professionally I am prone to snake bite because I have to work with snakes. But as an individual, who has a nice house, who has 24/7 electricity, who wears shoes, who has the education to understand the awareness how to not get bitten by snakes, I am prone to almost zero snake bite. But somebody who lives in an agrarian landscape, who doesn't have electricity or very limited access to electricity, who doesn't have access to the kind of education that's needed to be aware how to not get bitten, we can very easily say that from our position we can say, oh well, they should have used a light, or they should have put on a shoe, or they should have not put their hands into that garbage. It's very easy to say from our understanding because we know it, we understand that we have that awareness. But for them to have that awareness cannot come from our statements like use a torchlight. But for them to understand what is the importance of using a torchlight depends on how we design that narrative or the statement, where we make him or her realize why it is important to use a torchlight. So a lot of our educational materials are also very basic, very it's like as simple as using a zebra crossing. Do we have zebra crossings all over the country on every single road? We don't. So what if somebody doesn't have a zebra crossing on a road that runs by the side of his house? So how do you make that person understand what a zebra crossing is? Or how do you make the person who is driving the vehicle understand what the zebra crossing is? So it's a very complex situation. So even the educational materials that we are supposed to design for communities has to be curated, very well curated to the community level, by which they will understand, they'll get the essence of that information. Next. So the region that we wanted to study was Hooghly district because it's a predominantly agrarian landscape. people, like a majority of the population are engaged in agriculture, a very high snakebite burdens district as well. And there are a lot of crops that are cultivated round the year. So that was a perfect candidate for our study. Next. So what we did, what we did was there was no standardized snakebite data published from this district. All are anecdotal data. So what are the venomous snakes in this district? Spectacled cobra, next. Monocle cobra, next. Russell's viper, next. Common crate, next. So these are the 4 medically significant venomous snakes in the district, which we have known to have bitten people and people have died. What we did, we trained 14 wildlife rescuers. They all went 1 full year of training. And then there has to be like 2 people in the team for conducting the rescue. There has to be proper equipment. There has to be a compulsory dress code, full-length pants and shoes. And the rescuer should not be under the influence of any substance. And all of this is being monitored through a central phone number who receives the rescue calls and then deploys the keepers accordingly. Next. We used a platform that has been designed by the Oxford University. This is a free platform for data collection and curation and also analysis. It's called Epicolic 5. So we designed our rescue forms on this platform, and it's an offline platform. The best part is you can just fill up the form and you can upload the form whenever you are into network or Wi-Fi. Next. So this is just one slide I have used to show that you can understand how this app worked. So you can see the list of rescuers on the left. Whoever goes for rescue ticks his name and then goes to the next page where the date is mandatory, which comes on automatically. Then comes the time, then comes was rescued, was not rescued, but visually ID'd, but not rescued and not visually ID'd. So there were a lot of parameters that kind of streamlined the entire rescue information. Next. So what we got after 1 year of following this app for every single rescue we conducted in the Hooghly district was the number of venomous snakes rescued and the number of non-venomous snakes rescued. So the important takeaway from this is, if you look at the color codes, if you look at a banded crate rescued in a year was 28, which is a venomous snake, but not medically significant venomous snake, because at least I have not come across any bites in Hooghly district from this species in the last maybe 18, 20 years. Then comes Bungarus ceruleus, which is a crate, which is another crate, which is a medically significant species and which do bite people. We have rescued only 25. Then comes Russell's viper, which is 38. Then comes monocle cobra, which is just 10. And then comes spectacled cobra, which is 120. So from this, you immediately get the idea that what is the venomous interface in the district. So people get, so people face very less number of monocle cobras in an agrarian ecosystem or in a built-up ecosystem, whereas they face a lot of spectacled cobras. So somebody who has been bit by a cobra, if they can come and tell you only I have been bitten by a cobra in the house, so it is pretty much safe to assume that that person must have been bitten by a spectacled cobra, but not a monocle cobra, which will be much rarer. So these are the information that kind of helps us formulate strategies for education and awareness. Next. So these are again seasonal variations of the 5 significant venomous snakes that like function throughout the year. If you look at the dark blue line, which is the spectacled cobra, which we encountered 120 times in 1 year, it kind of dips after January and then it starts climbing in March. So it tells us, and we know that from March onwards is their mating season. So from mid-Feb, March onwards to April, they will breed. That's when males will be moving around a lot. So your educational campaigns during that month in certain regions or villages have to be like this is the time when spectacled cobras move around a lot. So you have to be careful around these areas. So you have already fine-tuned the areas that those people need to be careful about, not a very general statement that be careful around all these areas for all these snakes. So if you can fine tune your awareness programs also based on certain models and studies that can give you certain graphs, it becomes more helpful for the educators or also the organizations to conduct educational or awareness programs in villages, in outskirts. And again, very interestingly, if you like, you all have this idea that snakes kind of go for hibernation. But if you look at certain species, look at common crate. It spikes in August, drops in October. If you look at uh, the spectacled cobra, it spikes in July and it continues spiking throughout October, November. It drops in December. So it's not that snakes are not active in winters. And again, if you look at Russell's viper, the green line, you can see that the spike is very much consistent during the winter months. So these all tell us the ecology of snakes and the species involved in conflict. Russell's viper is one of the most conflict species in the country. Now, with the idea that snakes hibernate in winter, people will be very complacent going around. And with this information, now we can grid into our education system or our awareness programs that be careful of Russell's vipers during the winter months. Now, to make them understand why, we have to tell them that these are the months when Russell's vipers mate. This is the mating season of the Russell's vipers. That's why there is so much of activity and interface, because the males are on the move looking for females to mate. The females who have already mated are basking out in the sun for the better development of their embryos. So all of these, and given the ecology of the species, Russell's vipers are not active predators like cobras and kraits. They don't move around looking for food. They will identify a rodent path and they will sit there to ambush their prey. And that is when people step on them, they don't see them. And this is why it's very important to have certain studies to understand the ecology of snakes in a given habitat, the interface of human and snake in that given habitat, that can design your outreach or awareness modules and materials. Next. These are again the timings, different timings when we have rescued snakes. These are the age group of snakes that we have encountered during the rescues. Next. Now, this is very interesting. So the rescue calls came to a central number. We just got rescue calls which accounted for just 5.4% in the agricultural areas. Now look at the number of rescue calls in garden open yards. Look at the number of rescue calls from storerooms, from the kitchen, from the bedroom. If you accumulate all these, storeroom, shop, kitchen, courtyard, bedroom, bathroom, and then compare it with when we say snakebite is a occupational hazard, it's not. So if we want to define snakebite and to have a policy, whatever, if it's state level, regional, national, we need to give a very clear definition to what kind of a problem snakebite is. If you say snakebite is an occupational hazard, then I would argue that what occupation was the person doing in the kitchen, or what occupation was the person doing in the bedroom or the bathroom or the shop or the storeroom, because these are built areas, these are living areas. So snakebite is basically a rural hazard. It's a hazard that's there irrespective of whether it's in an agricultural area or whether it's in the house, in the bathroom, in the bedroom, in the kitchen, in the store. That's why it's very important to understand how to address or how to define snakebite in a given demographic. Next. So what we did was we generated a map and basically a heat map. So these are the areas with species what we, the earlier slide, please. So these are all the microhabitats from we have rescued the snakes, and the color columns are the species. So if you see the blue is the light blue is the spectacled cobra. So we have rescued like over 35 spectacled cobras from garden and open yards, then bird cages, then canal, then fishing net, then well, then bathroom. We had rescued more than 5 spectacled cobras from bathrooms. We have rescued more than almost 20 spectacled cobras from bedroom, from kitchen, from storeroom. So if you look at the distribution of these rescues over the different microhabitats, it's very unjustified to define snakebite as an occupational hazard. Because yes, if spectacled cobras were rescued predominantly from agricultural tract, yes, of course, then we can define it as a occupational hazard. But here we are rescuing it from built environment. So it has to be defined as a rural problem, as a rural hazard, not an occupational hazard. Next. So with the information we had, so we developed some heat maps based on the rescues that we have conducted. Next. If we zero in on that red area, next. So all these red marking, all the red spread on your map are built environments. They're all villages, and all the dots are the snakes that have been rescued from those points. Because we in that app we did have a GPS system where we can log the GPS sections for each rescue. So now, based on this information, what we can do is, whatever that hospital services this area, whether it's a government hospital, whether it's a primary health center, whether it's a rural hospital or a secondary hospital, maybe a private hospital, based on these information and these interfaces between venomous snakes and humans, we can come with a very informed decision of how many antivenoms need to be stored in that hospital, which seasons are the most human snake interface seasons, which are the months we need to be prepared for which species. So it's very, very interesting that it has to be a very holistic approach in understanding snakebite. It's not just going out to a village and organizing an awareness camp where we give very general information that, okay, these are the 5 snakes venomous, okay, this snake is hemotoxic, this snake is neurotoxic, this snake is combination, okay, this snake lives in these areas, but more informed information which is very seasonal. So it's very, very eminent that state governments invest more on education and awareness and outreach. Without that, no matter what good antivenom we make, no matter how comprehensive our medical clinical interventions become, we are still not going to be able to address the situation. The idea that we already spoke about at the start of the meeting was to like reduce 50% of snake bites and snake bite related mortalities and morbidities that the WHO had proposed. But to do that, the most important tool in a country like India would be education, outreach, and awareness. Without that, it's almost impossible. And with certain kind of data, what you can do is your communication with the society can be data driven. Because you'll have more facts about snake ecology. You'll have more understanding of the dynamics between the snakes and people. So you can adjust You can, based on that, you can now start your exercise on how you can address the population in adjusting certain things where they can coexist without bites. Next. To conclude this study, like, we have published, previous one, please. We have published that as an evidence for the government to look up, where we can understand which are the living areas, where are the conflicts more, which are the regions that need more awareness, and what kind of awareness, which are the areas where we can have a good stock of antivenom, which are the areas where there are species outside of the big four. What should we do about it? So all these decisions and policy making can happen only after we can conduct studies like this and create more evidence for the policymakers, be it on the national level or be it at the state level, to go forward with. But again, coming back to my earlier where I mentioned that the state does play the bigger role, because the state has to take up the framework that the center has designed through NAPSE, and there is a flexibility for the states to design that, to use that platform and design it according to their use or their ease of functioning and executing. But the state has to take the initiative, because most of the permissions for certain studies lie with the state. At the very beginning, if you remember, I have told about the short-term fixes and the long-term fixes. Only after the state does come up with the short-term fixes can the center now plan a national program which will address all the evidences that the states have created, and then can we have a very consolidated approach on mitigating or coming down 50% in terms of snakebite numbers and snakebite deaths. Next. Yeah, so again, integrate the rescue data with the hospital data. Like, you can look at your rescue data and see how many spectacled cobras you have rescued in a month. And then you can look at the hospital data in the same month and see how many people were bitten by spectacled cobras. That kind of confirms your hypothesis when you are doing this study. And then we can decide on which months are which species prone months. So that way the hospitals can also be prepared more to deal with those complications. Like, if it's a month where we have had good data, good analysis, and we have seen that majority of the cases were Russell's viper bites, now we know that Russell's viper bites often tend to go towards renal failure. So let's be prepared. Let's first protect the kidneys. Maybe be aggressive in our treatment regime, or have a very different approach in handling Russell's viper cases. These are all the hypothetical ways that we can think about when we have these data on hand. Next. Yeah, so again, most of the time we fail to understand that. We always try to think from a very anthropomorphic point of view, trying to address a problem which is caused by an animal. And we always try to kind of neglect or forget the animal. It's very important to understand the animal and its ecology, because if you neglect that species which is causing this problem, you will not be able to come up with the solution 100%, because a lot of your answers lie within the ecology of the species. That's why it's very, very important to study the animals, not just carry out very general awareness or general antivenoms. Next. So out of all this, what happens is, again, state needs to take the step forward. This was a poster that we designed in Bengali, in English, in Hindi, in Ohomia, in Mizo, in Santali, in Odia. So the state took up, the National Health Mission, Assam, took our poster. They designed it according to their region. They use their native language, and say, if this poster would have been made in English and spread across Assam, would this poster have had any impact at all? None, because these are the things that we need to be. So it's like sometimes we miss out on certain things, like this directive has come from certain department, so we have to print it. There's no point of printing this poster in English and distributing it in the villages of Assam. It has to be in the local language. It even has to be the micro language of a region, not necessarily Ahomia, maybe Boro, maybe other languages. So, sorry, we need to address the situation based on the information we have collected, based on the data that we have collected, based on the analysis that we have got out of the data, not just a very general way of spreading awareness, or thinking that we have printed 20 lakh posters and we have distributed, so now there will be less snake bite. No, it has to be very curated. It has to be curated to the very local level. Next. Out of the 18 years, 20 years working on Snakebite with a lot of my team members and colleagues and institutions, these are the few things that we have recommended that we need to do across the country. We have to continue mapping the venoms of thematically significant snakes from different regions. We need to collaborate with the anti-venom producers to design and test new products, which is a huge obstacle in the anti-venom side of things, because as you know, the Director General of Drugs and Cosmetics, they have an act where anything that you make apart from the already established product needs to go through clinical trials. So now conducting clinical trials is a huge bottleneck in a country like India. Now, how do we overcome that? How can we change policies in doing maybe a preclinical study, not necessarily a clinical study, and see how those products work? Because to be honest, the present Indian antivenom has never been clinically tested. There has been no clinical trials with the present Indian antivenom, but still it is being used. But after the amendment of the Act in 2019, if I want to use a monocle cobra venom in the preparation of an antivenom which is effective for West Bengal, I have to do a clinical study. I have to do a clinical trial. Otherwise, that product cannot be used in the state of West Bengal. It will be considered a new product. So these are the areas, these are the bottlenecks that we have to investigate and brainstorm more on. And yeah, lastly, but more importantly, we have to invest more into education, awareness, and research. Next. So whatever basic research we have been able to do across geographies in India suggests that we need different antivenom formulations, maybe regional, not necessarily a state level antivenom. But of course, if a state wants to go ahead, they have the funds and the will, they can go ahead. That might help the adjoining states in that region. So that antivenom can become a regional antivenom. But again, it has to be tested. Again, we have to see how much cross neutralization it is doing. But more importantly, the antivenom design, pan-India antivenom design, has to be based on biogeography. It cannot be just east, west, north, south kind of antivenom or venom collection centers. It has to be very biogeographically understood and decided. Next. All right, I'm done. I'm up for questions, if anyone has questions.
Participants, you can unmute yourself and ask the questions directly to sir if you have any, or you can also drop it in the chat box and I can share it with sir.
I think Sanjay asked a question regarding Mizoram, what antivenom is being used in Mizoram. It's the same polyvalent antivenom design for the big four snakes of India, which is being used in Mizoram. It has a certain degree, I would say about 35-40% cross neutralization that it does with monocle cobra bites, but it doesn't do much with any of the crates or other pit vipers.
Thank you, Vishal.
Thank you, Sanjay.
So if anybody else have any questions, you can share it with us.
So, am I audible?
Yes, sir, please go ahead.
Okay. Thanks, Dr. Satra, for this. I would say it is a commendable uh, lecture I have ever heard.
Thank you, sir. Thank you so much.
Welcome. And actually, our key objective is uh, to include this snakebite thing in the disaster list, state disaster list. And you have highlighted many points which are of values that why we need to include, why the state should come forward, why all these things are actually covered up. At the same time, I would
Thank you.
like to I'd like to thank Dr. Surajit Giri for his commendable works and for which the Assam government, the CM of Assam, he has written a. He is the key person. Maybe he is supported by many other people there in Demo Hospital in Shivsagar, but I know that he is the key person, and this achievement should be cherished. Should be cherished, and I am the one. Actually, I would like to love to visit his place and see what type of work he has been doing, and whether it can be replicated in other places.
As far as I know, he has done an amazing,
Amazing work. Yeah, yeah,
and I very strongly support and believe that it should become the model for at least the entire Northeast, and also some of the northern and western Ghats states of the country.
yeah, yeah. I fully agree with you. I fully agree with you because yeah, there are certain areas which are very much technical, but there are non-technical areas too. Like uh, if it is in Asia Pacific region, so Bhutan comes under Asia Pacific countries. So in the northern part of Bengal, West Bengal, if you see that common people, they say that king cobras we have never seen. We have never seen king cobras attacks or king cobras of this size. So that actually very recently we have started seeing, and it is the common people's perception and the way they have translated. So
Yes,
they said that it is because of flash flood from Bhutan, king cobras from Bhutan, forests of Bhutan, king cobras have come to. So it may be true, it may not be, but yes, we need to do a study, proper study. So
yes,
that way, what I meant to say is that uh, the geographical boundary we have talked about India, and it is very diversified. It is
yes,
northeastern part is different, northern part is different, southern region is different. So it is very diversified area. So if we see the cases of India, then we can uh, relate them with Asia Pacific regions too. It is my belief, and geographically, like and that is East Pakistan, and that part is West Pakistan. So that was the geographical boundary, and through that geographical boundary, you can control the government can control the human population, not the wildlife population. So wildlife population, they do not have passport and visa. They can come from any place and they can go to any place. So Asia Pacific region, if we say, so that is what Dr. Shastra has said. That is common for Bangladesh also. That is common for
Yes,
Bangladesh. That is common for
yes.
Nepal. That is common for Bhutan. So he has raised for Thailand. So some of his discussions for reasons, because I am in Mizoram now. So I'm traveling. However,
So one of my
I
case study
I
was also from Mizoram.
yeah, I know. I got that information. Uh, at that part, I was there. So
Right.
and what I would love to request all the collaborators to come forward and uh, just see the letter, because a letter has been drafted by the chairperson of Fair India. He has sent it yesterday, and that letter can be edited. He has given that permission to edit that letter. He is not present in that in the meeting today. He has another meeting. He said, so if we can just concentrate and just think of uh, the advocacy terms, how the states can be advocated for including the snake bite cases in their disaster list. Number one. Number two is, I am very much thankful to Krupa for her tremendous effort, what she has actually put. Lots of efforts she has put, and maybe many people means maybe none of the participants know that it was her engagement ceremony or something she said. uh, so she was uh, on leave, and at the same time she did some work. She has discussed with Dr. Santra. She had discussed with Sanjay Da. She had discussed with many other people, and she had put her efforts. So I am very much thankful to her, and at the same time, I'm thankful to all the participants for listening to this, and I'm requesting them to this we will circulate. I am requesting Krupa to send the recorded version, and mm, how many people have got registered and how many people have joined. So that I am not actually counting because in one system there are 4 people joining. So that I know. I know because from my system there are 4 people joining, 5 people joining, and similar things are happening in other systems. So we need to further discuss, and we need to uh, have another session on this particular issue after just going through what through the in the recorded version, what Dr. Shastra has said minutely, uh, and after that we can think of advocacy terms, how we can do the advocacy, how we can draft the letter, how we can edit the letter, and what can be done from our. So I am now thanking all of you for listening to this session, for this vital this thing, vital program, and requesting all the collaborating agencies again to please support Krupa, because Sphere India Academy is taking the lead for organizing the session. So that way it is Sphere India Academy, but she is doing it for the Asia Pacific region. So thank you so much.
Thank you so much, sir. Thank you. Also, thank you to our collaborators. Thank you, Universal EHS and team for being very patient in collaborating with us on the session. Thank you so much, Vishal sir, for being uh, very sweet and being available for the session. And thank you so much, Aniruddha sir, for your blessings. And thank you, Sanjay sir, for your wishes to me on my moderating. Thank you so much. And this is our first session in a series of 19-month-long webinar series we are planning, and it has been successfully completed. And I'm very happy we kickstarted with a very important question. And before I finish the session, Vishal sir, I personally have a question for you.
Yes,
If
please.
you are ready to answer. Yes. Sir, we were talking about human-snake interface, the seasons, and also the series we are focusing on climate change. So
Correct.
could you please tell me if also Aniruddha sir was saying about how king cobra was spotted in a place that has never been spotted.
Correct.
So do you think there is any correlation between all this, and can you give us a few insights on that?
There is. Climate change is going to change a lot of the dynamics that we see when it comes to snakebite in India or anywhere else. For example, when I was surveying Himachal Pradesh, we went around showing people photographs of snakes which are medically significant, and none of them in the higher elevations, like say above 1800 meters or 1900 meters, nobody identified Russell's viper as a medically significant species, but they all identified the Gloidius himalayanus as the species responsible for bites. With like shifting climate patterns in the country or around the globe, there are chances that certain species requiring cooler environments might move up. Species that require hotter environment might move laterally or towards south. We don't know, but definitely climate change or climate change associated other phenomenons are going to play a very important role in shaping the future snakebite scenario across the globe, not just India. And mostly tropical countries will be the ones to look out for, because those are the countries where we have the largest distribution and occurrence of snakes. Places like Africa, Latin America, Southeast Asia will be the regions that will be hit pretty hard by climate change and associated snakebite problems. And regarding species being sighted for the first time and all of that, we generally tend to look at maybe one WhatsApp forward or one newspaper article, which I necessarily do not agree with when it comes as a reference to say, well, yes, this is the first case. There has to be a very systematic surveys and studies conducted in those areas to understand whether they have shifted. Because one of my good friends, Jigyashu Dholia, who did his PhD on king cobra ecology in the high elevations at Wildlife Institute of India, found king cobras in Uttarakhand at 2,700 meters. So we find king cobras in the Sundarbans, and we also find king cobras at 2,700 meters. So they are a pretty widespread species. Now, it's too early to comment on how climate change is going to change or force the animals to shift patterns. One thing that will be very interesting to look at will be the breeding biology of a lot of venomous snakes based on the climate change scenario and factors. For example, we already know that in West Bengal, the monocle cobra, which is a medically significant venomous species, breeds twice a year. So one is the monsoon period, we see babies. Then again, we see babies post December. So that is kind of quite interesting, and we might need to study certain medically significant venomous snakes when it comes to climate change. Hi, Josh. Hi. Not yet. I'm still at the question and answers. Sorry for that.
Thank you, Vishal sir, for answering our questions. And I think without further delay, I think I should let you go. I think you are already getting calls. Let me display your thank you message to the participants. And I hope the session was clear and as expected by the participants. And if the participants have any questions, please feel free to write to us and we will direct it to Vishal sir for him to answer it if you have any. Thank you so much, everyone. Thank you so much, Aniruddha sir.
Krupa, am I audible?
Yes, sir. Yes, sir.
Okay. So may I request Dr. Giri to say a few words about?
Yes, absolutely. Please, it will be an honor, sir, if sir could speak. I think sir has left. I'm not able to see his. Sir?
Okay, Krupa.
Unfortunately, Giri sir has left, I think. But he was present all along. Thank you so much to all the participants. Thank you so much to Vishal sir. Thank you so much to Aniruddha sir and Sanjay sir for all your guidance. And I'm very happily ending the session today. And we will meet you in yet another session next month. And from next month, we will have each session every month on the 20th of every month. So that is going to be a constant. And I would like to request all the participants to keep in touch with us and join us for the following sessions as well. Thank you so much.
Thank you so much.